It's 12:05 in the afternoon here on 90.3 FM. It's Wednesday. That means it's Joe Steckler Day, helping seniors of Brevard. Joe is off again today, still recuperating, and we hope to have him back here in the Magic Air Chair real soon. But in the meantime, John Harper with you, along with Kerry Fink. Hi, Kerry. You staying warm?
Doing my best. And, you know, this is a momentous day in Helping Seniors history because today is actually the day that Joe Steckler is coming home. Hey. So he, when I spoke to him, I guess it was Monday night, he was saying, you know how when we were kids, it was like one more sleep until Christmas. It was like one more sleep and I get to go home.
Yeah.
So Joe is looking forward to getting back home, back in the saddle. You know, when I talked to him Monday night, John, he was in good spirits, and he said, I have written my arm off because he has been signing. You know how we do the mailing about the Helping Seniors car raffle. He's been signing. I took him a box that it was like a copier paper box full of letters that he's personally, and you know Joe, he'll write a personal note on each one of those. So he has been signing those away. They're going to go in the mail because we're getting ready to get things ramped up with the whole Helping Seniors car raffle.
Yeah,
so
that's coming up again. It's an exciting time.
Yeah, so we've got the date set. It's going to be October 9th. And again, we're going to be out at the American Muscle Car Museum. And so we're so excited about getting all that ramped up and going. But the other piece of news for today is I'm excited. On the one hand, normally this is the first Wednesday of the month, and for those of you that have been following Helping Seniors Radio for quite a while, you know normally our guest is Bill Johnson, who's board-certified elder law attorney. Now, Bill is in the middle of doing some attorney kind of things. He said, Kerry, I can't make it this particular week. He has a couple of things that I guess with court calendars and all those kind of things that had to come up. So we called a very good friend of ours in and said, would you be kind enough and to come in? And we haven't had a chance to talk to you in a while, but she's a friend to Helping Seniors, has been really instrumental in helping us throughout everything that we accomplished last year with the Helping Seniors car raffle. And she's now gone on and become really big time corporately, I would say. I am talking none other than about Charisse Durham. How you doing, Charisse?
I'm great. How are you?
Yeah, no, first of all, I can't brag enough on you for how much you helped us in the middle of COVID, trying to get everything going the right direction with the Helping Seniors car raffle. And, you know, the reality of it was, Joe told me that was by far the best success that we'd ever had so far in the history of Helping Seniors, and we could not have done that without your help.
Well, it's a team effort because this is such a unique resource for Brevard and such a needed resource. And I just anything that we can do as a team to promote and to make it successful and help more seniors is what we got to do.
No, absolutely. And so what we talked about today was our show title is going to be, because you worked through the entire thickness of everything we've been through COVID from the inside out. And so we're really going to talk about 2021, the road to recovery from COVID. And I think, John, you and Jim have some information that we want to get to on this as we start this conversation.
Yeah, we wanted to give a COVID update that we've been doing now at the start of each one of our shows every Wednesday. First, we have from a news conference with Governor Ron DeSantis, his comments and remarks about Johnson & Johnson. They are about to present to the marketplace a new vaccine that has some incredible properties associated with it that could be a big help to starting to turn the pandemic around. So let's give a listen to what the governor had to say about that.
Good news about the phase 3 clinical trial data from the Johnson & Johnson vaccine. And if you watch some of the headlines and reports, it was like, oh, not as effective as Pfizer and Moderna was what I was seeing. And I was like, oh man, that really stinks. But then you look at it, and yeah, they said 66% efficacy in terms of preventing infection, and it was higher in the U.S., but they looked at all worldwide data to come up with that. But after 28 days, one single dose of Johnson & Johnson vaccine was found to be 100% effective at preventing death, and almost 100% effective, practically 100% effective at preventing hospitalization. And so, look, to me, if no one got infected, fine, But if you have something that will rule out fatalities and rule out, for all intents and purposes, people even being admitted to hospitals, that is a successful vaccine. Sign me up for that. And so we look very forward. They're going to be submitting an application for emergency use authorization probably this week, maybe next week, but very soon. If you look at the way that the FDA handled the Pfizer and the Moderna, once that application is filed, they then set a date where they will then convene. So that was, I think, 7 to 10 days after the application was received. And that would mean, under that timeline, we could get an approval for emergency use this month of February, which would be a really, really good thing. So I see a one-dose vaccine, very easy to store. You don't have to have -70. You don't even have to have freezer. You just put it in the refrigerator, you jab it one time, and then you don't have to worry about people coming back for the booster shot. So, and we'll get more data. There'll be more put out beyond just what Johnson & Johnson has done. And even if it's slightly less, quote, efficacious than Pfizer, Moderna, for workforce people, for folks that may be younger with comorbidities, to me, this is something that we should be very excited about.
Certainly good news coming there from the governor, and the vaccine that Johnson & Johnson will be presenting to the marketplace here in the country, and they'll be rolling that out next week. Now, we also have President Joe Biden and his update on where we stand with the campaign against the pandemic, and the fact that many of the pharmacies around the country are also going to be joining in next week, and they will be able to give vaccinations as well. So let's hear what the president had to say.
We've already identified suppliers, and we're working with them to move our plan forward. The biggest problem, I hope you're all asking me by the end of the summer, that you have too much vaccine left over. You have too much equipment left over. That's not my worry. I hope that becomes the problem, rather than we somehow find interruptions in supply or access. These aggressive steps to increase vaccine supply come on top of the steps we took last week to get more people vaccinated for free, to create more places for them to get vaccinated, and to mobilize more medical teams to get shots in people's arms. We directed FEMA, the Federal Emergency Management Agency, to stand up the first federally supported community vaccination centers. And that work is underway. We're working to make vaccines available to thousands of local pharmacies beginning in early February. It's a couple weeks off. And that will enormously expand our reach. Last week, I also signed a declaration to immediately begin reimbursing states 100% for the uses of their National Guard to help the COVID relief effort, both getting people, getting the sites set up, and even using some of their personnel to administer some of the vaccines. And I think it's something Democrats, Republicans, governors alike have called for. We're also expanding testing, which will help schools and businesses reopen safely and protect the most vulnerable. And we formalized the Health Equity Task Force to ensure that equity is at the core of everything we do in urban and rural communities alike, to make sure those people most significantly damaged have access. We have to change, we have to move in a direction for those communities that are hard to get to.
So some encouraging news coming from both the state level and the national level, with right there President Joe Biden talking about the fact that the vaccinations starting next week will be available at pharmacies, selected pharmacies throughout the country, and that is expected to expand by about 7,000 pharmacies by late spring. So that is definitely encouraging news, and it sounds like, at least, Kerry, we're moving in the right direction.
Yeah, 100%. You know, that was the thing we talked about last week when we were in the studio. We had Chris Morse from the Helping Seniors Travel Club. We had Jennifer Helen from Seniors Helping Seniors, and we were talking about, I think there was 6 of us in the between the control booth and the on-air studio, and 4 out of 6 have already had their vaccination. And today, with Charisse Durham from Validus Senior Living being here with us, I think today there's four of us in here, but three have now had shots, and everybody is doing fine with that, right?
Absolutely. I'm feeling pretty good about it.
And
Well, that certainly is great to hear, in the fact that people are having pretty good success from what I'm hearing, other than sometimes perhaps a painful arm. But overall, there have been very few side effects, and so that again is encouraging as well.
yeah, and I was going to say, on top of that, too, even our president and founder, Joe Steckler, he's had his first. I think you said you're going back for your second,
Yeah, I'll have my second shot coming up in 1 week, so looking forward to that.
So good. Maybe by the time we have the next Helping Seniors radio show, we'll have a report from somebody who's been all the way through the cycle.
Never thought I'd be happy about receiving a shot, you know.
Yeah, well, hey, listen, if it gets us back to normal, I'm all for that. And so that was actually the thing that we really wanted to kind of focus in on today, while we have the blessing of having Charisse Durham here in the studio with us. Now, Charisse, you have been an expert in everything assisted living, memory care, all those kind of things, going back to your days where you helped organize things that were going on up from your home state of Georgia, but then most recently here in the Space Coast area. But now you've actually gone kind of corporate. You're like all over with this big organization called Validus, which people probably do know the name of their location, called Inspired or something that they've had here.
So we Validus is a great senior living management company, and we kind of have 3 different product lines. We have a assisted living, memory care, and independent living, and we do that in several different ways. So we have some communities that we own and manage, and then we have some that we have worked with investors where they have invested in building a community, and we do the management end. And then we also just manage other groups. So Superior residences near the Orlando area, they're under our management now as of November. But most exciting to Space Coast is we are working with some investors to open the new Allura by Inspired, which is up in Rockledge.
Wow. I'm looking forward to us talking a little bit more about what's going on with that property here, because that has to do, obviously, with folks who live in Brevard County. But we kind of decided we were going to title our general discussion about the road to recovery, to COVID recovery from 2021. You know, I was just thinking, it was about a year ago, I think you did one of the very first Helping Seniors updates that we were doing, kind of in response to this whole idea of 30 days to stop the spread. And here we are a year later.
A year later, yes.
And I remember I was asking you, I said, you know, how does this affect everything you're doing trying to keep residents safe where you're at? And it was really you guys really rose to the challenge.
Yes, absolutely. You know, senior living as an industry really did rise. We saw our teams just provide more care. We saw our activities keep residents engaged. We saw our cooperative medical teams come in and really pay attention to any signs of depression or isolation and keep residents healthy. We saw just an enormous outpouring of support between the car drive-throughs and the parking lot. You know, I'll never forget looking out the window where I was, and there was a group of cars that had appeared, and it was a church group that was going from senior living, you know, assisted living or rehab locations. Every couple of days they would just drive to each location and have a prayer meeting in the parking lot.
Hey, that's great.
So, I mean, we had just such a response of support. The most notable, I believe, is those that are giving direct care, whether they be housekeepers or maintenance or direct caregivers, CNAs, the nurses. They adopted these seniors in a way that because of the restrictions, they couldn't have the same type of interaction with their own families. And I saw the most just loving response from all of those that work in senior living to engage these residents and really help them feel like, yes, there are tons of people who really do care about you and fill that gap. And it's been an amazing thing to watch in a time where sometimes we question how much people care about one another, and it's been very heartening to watch that.
I was thinking about that because early on, I remember, we had for all of that year, we had our Helping Seniors offices over in a place called the Senior Resource Center of Brevard, which was attached next to Zon Beachside, the assisted living over there. And I remember when Greg Kennedy, who's the executive director, he came over to our offices. He said, Kerry, he said, y'all are not supposed to be coming into our building. He said, I hate to explain it to you, but we have this whole COVID lockdown. And at that time, none of us had really heard, what is this COVID? We'd heard something about, a virus that may be a problem. But I remember when he shut it down, and I remember then you and I had a conversation. He said, no, we're doing the same thing here. And I thought, because none of us knew that this was going to be as serious as it was at the time, but you guys called it exactly right.
We went, and a lot of places did, when they first started saying maybe masks or maybe limiting traffic or maybe this, maybe temperature checks, maybe hand sanitizer, maybe washing hands. It was pretty much overnight, and it was a quick change that, no, we've got to say, if maybe this helps, let's do it all.
Yeah.
To limit and to really keep our seniors safe, and that's what it's been. It's keeping them safe.
Yeah, and then you hear the horror stories, which made us all really scared down here. You heard the horror stories up north, but you guys were real careful to be sure that you kept everybody safe through the whole thing.
Yeah, a part of that I think is just that we did jump on it very early. We took it seriously. And I do credit Governor DeSantis with some of his measures, and he has really been great about this and what we've done. We've been able to adjust our procedures and our policies to keep them safe. But then now, as we are on the path to recovery, we are able within the industry to allow for visitations in some different ways. It's open to interpretation, so everybody's doing it a bit differently, but as long as there's not a positive case for 14 days, there's a window of policy. So every community is doing it a little bit differently just because they're doing what they feel is in the best interest of their residents. But families are getting some contact. It may not be the hugs yet. That's from the get-go. That was the first thing that I said. I want the hugs back. That's the end result.
I was thinking about this because, like I said, you literally were probably about the first person that we ended up. What we did, folks, is we created this thing called Helping Seniors Updates, which was basically a Zoom call. That's how we were able to communicate. And what our goal was when the whole COVID thing first happened was to try to get in touch with people who we knew were working daily with seniors to say, well, how are you keeping seniors safe? What can we learn from what you're doing? And I remember early on, virtually everybody we talked to, from folks like yourself that were connected in the assisted living to folks like people who are going in and doing senior care in people's homes, home care. Everybody said, listen, if we stick to the universal precautions, the CDC guidelines really haven't changed. Wear the mask, wash your hands, social distancing, don't go out if you feel. When we did all those things, it seemed like we stayed safe. But then the next thing, and I remember as we were talking even over the summer, you said now it was shifting more to make sure that we would socialize seniors so that the isolation aspect of all these lockdowns wasn't causing problems. And you, in particular, took a lot of time and care to make sure that in the assisted living memory care space, you guys were doing that for the folks you were working with.
Yes, and it goes twofold. One, inside is one thing and outside is another. So the perception from the outside was, those poor seniors who are on lockdown, God bless them. It was a very negative connotation, but we fought that. We fought that hard because those that do live in assisted living or that are in a community of any kind, life did not change as significantly as it did for those on the outside. We still had the same dining standards. We still had the same activity standards. We still had all these different things that were part of our normal day-to-day life. So it didn't change as much. And then on the inside, we just kept rolling. We had to modify, but it was an amazing thing to be able to think outside of the box.
Yeah, and now that you're elevated, here we are, we're going into 2021. Vaccines are going in folks' arms. I mean, you can imagine, while even I think here they were talking last week, we were talking about there being vaccines possibly available as close as your local Publix and things like that. And I know it's a fight to get in line and all that right now, but you can see like maybe 3 months down the road, everybody will be accommodated, and it's going in the right direction. So I keep saying, if we just keep the same precautions going and we don't let up our guard on it, we're going to be fine when we get to the other side. But since then, you got picked to move to this whole corporate level. So now you're seeing it from, instead of just a Brevard County view, you're seeing it from like the 50, you're seeing it in Orlando, Jacksonville, wherever you guys have all these. You're seeing how how your entire company is working to keep seniors safe all throughout.
Yeah, and it's really nice. Right now, I'm mostly in Ocoee at our Inspired Living at Ocoee community, which has been a fantastic community to be a part of. From there, we just had our second vaccination clinic yesterday. Mm-hmm. So in that particular assisted living community and several of the other Inspired and Superior residences, we're already past our second dose for all team members and all residents. It was open. And then we even took the plunge and offered some major incentives for new residents so that they could be considered a resident and get their vaccines with us. Wow. So, in a time of financial hard hit because of COVID, to actually give seniors a break to say, hey, come on in and let's make sure you get those vaccines as soon as possible. That was great. So we have seen communities that have had the opportunity to be fully vaccinated. And that's really exciting, because I believe that the more we get those done, the more chance we have of being able to relax even some of the restrictions that we still have.
Yeah, on the second half of the show, I really want to get into, I want to learn about the community that's coming to Rockledge here in Brevard County, because obviously that's important for all of us here. But I also want to keep us on this tact of talking about what do we think the road ahead looks like, and how do we keep seniors safe and happy going forward. So, but before we take mid-show break, I do want to go ahead and get a number out so people, if they want to get in touch with you and hear a little bit more and maybe get some information about these communities, that we have a way to that people could look up and get in touch with you. We're talking with Charisse Durham with Validus Senior Living, a big organization that has a lot of expertise in senior management around really, I guess, around this whole area.
Yeah, Southeast. So I'm always happy to give out my cell number, because, it may be a son or daughter living in Brevard, and mom or dad is in Orlando, and they're just trying to navigate this. So my cell is 813-382-3584, and I'm happy to put you in touch with other resources, just much like helping seniors, even a little outside of Brevard.
Sounds great. All right. Well, John Harper, we're going to be back with more of Helping Seniors Radio in just a few moments.
12:33 is our time here on 90.3 FM as we continue with the Wednesday edition of Helping Seniors of Brevard. I'm John Harper, and with more of the show, here's Kerry Fink. Kerry?
Thank you, John. I was just saying, normally the first Wednesday of each month, we would be having a great conversation together with Bill Johnson, who's a board-certified elder law attorney, been friends of Helping Seniors. He goes way back, just like you do, John Harper, with Joe, even before there was a Helping Seniors. We're in our 10th year of Helping Seniors now, and you guys go way back with him, back to the Brevard Alzheimer's days and all of that.
Yeah, we go back... That's well over 25 years. In fact, it's actually pushing close to 30.
It's amazing.
Yeah,
it's amazing.
Tell me about it.
Well, normally Bill would be here with us, but he's off doing lawyerly kind of things today. He sent a note. He said, if you guys could cover for this week, I'll be back with you next month. And it's another big day on another front, because Joe Steckler, our president and founder, is heading home. Those of you who have been following the adventures of Joe, as you know, he had knee surgery last summer to help him with his walking. and then ran into some complications. Not necessarily the surgery was successful, as I understand, but had some challenges, and so wound up. He's been over at a place where they've been doing like nonstop rehab. He's been doing like 3 hours a day worth of rehab, getting back on his feet. But today is his day. He gets to go home. So I know when we spoke, he's really looking forward to that. He's busy writing the articles that we all like to read in Hometown News and Senior Scene Magazine and Barefoot Tattler and Ebony News Today and Aldea Today. You can't really open up a publication in Brevard County and not find Joe advocating for seniors someplace in there. So with those two things, we were very fortunate to have Charisse Durham shift around her schedule a little bit so that she could be here and be with us on the radio today. How are you, Charisse?
I am fantastic. And while we're on the note of Joe and the adventures of Joe, I think cumulatively, if we really sat down and said some things about what he has done for this local area, it's just enormous. It's so impactful. I just have the utmost respect for him.
Yeah, he's unbelievable. He's 87. He takes a knocking, but he keeps on rocking, and he's always fighting for seniors. You know, they call them the Joe's Clubs all throughout Brevard County because he was instrumental in getting those all set up. He set up through Helping Seniors the Helping Seniors information line, which it's helped thousands and thousands of seniors. We get like 100, 125 calls every single month. And Kim Bernard, our education specialist, is on the phone really sorting out some pretty complex situations for folks.
She's a champion.
Yeah, she really is along the way. And so we're just excited about the service of Helping Seniors in that respect, but also really, we're so appreciative because so many good people have come along side Helping Seniors to help us with this. I think how blessed we are. An attorney charges $400 an hour, and he'll give this time to Helping Seniors to come and help people learn about the things that are really important. Joe has always talked about having to have an aging plan, so like what's around the corner. And that was one of the things you and I said we wanted to talk about in the second half of the show, is like a lot of people put a lot of plans on hold because of COVID. Well, this isn't the right time. I'm just going to hunker down. Maybe that was safe. Maybe it wasn't safe. Maybe somebody was thinking about assisted living or needing to make some kind of move like that. And now that things are starting to open up, as we talk about this road to recovery, what do you see happening?
So I saw through the past year a lot of seniors that were on the cusp of, saying, I'd really like to downsize. I'd like to have, what we call cruise ship living in the senior industry. I'd like to have somebody cook and clean and, just go down and have an activity or not if I don't want to, those kind of things. And everybody just hunkered down, like you said, and stayed in place. And what I have seen over the past especially 3 to 4 or 5 months, has been those that have moved into assisted living. We pretty much off the bat at least do a consult on depression. Isolation does lead to depression. We know this. So we've seen a lot more occurrences of that, and that's what's perpetuated their move into assisted living at that time. And now we've got the vaccine. Like I said, our community, COE and several of our other communities have already had their second vaccines, and we're seeing a lot more traffic in terms of people that are ready to make the move now that they're getting the vaccines and they feel a little safer. So we're seeing a huge surge in calling about themselves or their moms or dads, about touring, which is safe now, and doing the move. Movers even have protocols in place. So I'm seeing a lot more of the sigh of relief. And, as time goes by, and I think it gets safer and safer and safer, we're seeing a lot more of that. So it's really the opportune time, like our new Allura by Inspired in Rockledge. That's what we're seeing there as well, because they will open in April or May. Okay. So what that does is it gives those incoming residents time to plan, time to make their plans, time to see and be, in the Navy they call it being a plank owner when you're on the ship and it's being built. But for us, we call it the Founders Club, and they have special pricing and special perks and things like that. But it's all industry wide. I think we're seeing a lot more people say, okay, now it's time to ease up on those brakes and move forward with that quality of life. We're ready to go forward with a quality of life that's different.
Yeah, I was thinking about this because we're going to talk a little bit before the end of the show also about the Helping Seniors Foundation Cruise, which is a fundraiser for the Helping Seniors organization. And again, it's one of those things, the date is set, by the way, that's May 30th. So it's coming up May 30th, and we're coming out of Port Canaveral on a beautiful, beautiful, luxurious Italian ship called the MSC Divina, 7-night sailing. It will spend 2 days at Ocean Cay Preserve, which is the private island that they have in the Bahamas. It's beautiful if you like beaching, snorkeling, all those kind of things. It's just a wonderful place. And then it's also going to travel over, so you get to see Cozumel and Costa Maya along there on the Mexican coastal side, which is absolutely beautiful. So it's going to be a great cruise. And it's funny, Charisse, because we had originally set a date of October of last year, and we were going to try to go out with it. And then, of course, COVID. And then we had talked about moving it to January, thinking like, okay, that'll be the right time to do it. And so now we've moved it to this May 30th date. And, I was thinking about, we were talking that normally once a year we'll take a cruise vacation, or, we were having this conversation at the start of the year in our family. We were saying like, well, you know what? We didn't take a vacation at all last year. And I know there's so many people who put so many plans on hold throughout all of this. And so it was very unusual, and then started to add up. So, well, normally you'd take a couple of plane trips during the year. That didn't happen last year. I mean, it was just an unusual year, and I'm sure that's being reflected in what you're seeing. So tell us a little bit about, what's going on with Allura. So I want to hear about this because this is right here in our backyard.
Yeah. So they are able to do the hard hat tours now. They're able to have people come and see the walls are going up. If you've driven by, it's near Fisk, and it's going up, and it's going to be beautiful. I've been to several of our other communities. Specifically, we have one in Royal Palm that just opened late last year, and it's smart design. It's very high end. It's beautiful, but it's reasonably priced, and they do fantastic services. But it all comes from the moral compass. As a company, we have a moral compass, and we care, and we think, we understand, we act quickly. We're generous in spirit. My favorite part of our moral compass is that we commit to being better 1% every day. Just all we need to do is 1% every day, and pretty much every day I've got a little 1% thing on my computer. I'm like, did I do my 1% today?
Yeah.
So that makes a big difference, and Allura is going to be no different. They do have investors, so there are owners that have been there through the build process and that have a real stake in seeing that community makes moms and dads happy, because that's what we do, is we take care of moms and dads. So Melissa and Chris have been over there for months, and they are happy to host anybody. So I'll give their number out, and they'll be happy to talk to someone about what they've got to offer. Just go tour. It's going to be a community center as well. They'll have activities and education opportunities and things like that once we're able to. And they're, like I said, opening in April or May.
Wow.
So it's going to be a community partner.
Yeah.
So, go and see and learn what they're about. And it's a really great place. So you can call them at 321-427-9227 to go out there and see it before it's really even open.
So again, this is in Rockledge, and this is, so again, what type of residences?
They'll do assisted living and memory care, and
Okay.
then independent living is going to be in the next phase.
Okay.
So it'll be full service, and they have a dog park and
Wow.
a fitness studio and rehab on site, and just so many amenities. But our website can detail those things, and if you follow the Facebook, you can also see virtual tours and drone tours, and it's very interesting. If you're engaging in any way, it's worth a look.
So how do you, if we're going to hunt it down on the internet or look for it on Facebook, I want to make sure that we're spelling Allura correctly.
Yeah. It's Alura.
So one L. Alura.
Yep.
And so we can hunt that down on Facebook. And if you have that number, let's go ahead and give that phone number one more time. Allura. So this is in Rockledge. Alura. And I imagine because it's brand new, it's going to be like state of the art in every way.
It is state of the art in every way. They have a unique system of care where the caregivers have electronic devices, and everything that needs to be done for any resident is auto-populated, so they can automatically click when it's done, so that families can be assured that, yes, mom is getting all of these services.
Yeah.
Our door locks record when there's access, so how many times was mom or dad checked on? We've got that information. I mean, it's just, we've embraced technology to work smarter, not harder, and it frees us up to care for moms and dads, not just task. So that's really a thing that we appreciate, is the fact that we can make technology work for us, but still allow us to focus on the personal side of things.
Yeah, no, that's great. So we're going to give that phone number again so that you can reach and maybe get a hard hat tour of Allura, Alura, by Inspired Living. And, you know, I got to say, even though it will be a new community, knowing the caliber of care, for example, that you provide, and I got to believe that's exemplary of the kind of help and the people that are involved in the organization. Like you said, everybody's trying to do 1% better every day.
Well, I mean, and one of the things that I really love about Allura is it does embrace technology. So it will be brand new. So it's completely sanitized.
No doubt.
Even from day one. But all of our communities have the fogger machines. There's UV light ways to kill. And that's kind of, we'll talk about that with the cruise, because cruise ships have gone to that too. There's UV light on their air filtration systems. There's a lot of things. But if you're interested in seeing all those things at Allura, it's 321-427-9277.
Yeah,
I'm sorry. I messed that up. 321-427-9227.
Let's do that one more time.
321-427-9227.
There we go. All right, so that is Allura with one L, Alura, going to be opening up in Rockledge, and I guess there's probably some real good opportunities to take a look at that, especially as they're getting everything opened up.
Yes, it's an enormous undertaking to open a senior living community, but when you embrace the community, and I was very happy that I got to be a part of helping name some of the lounges and kitchen areas and things like that. And we've really dug into some of the history and some of the local things, and so it's gonna really reflect the community on the inside.
Yeah, can't wait to see that. And then, like I said, for yourself, if there's people that are maybe have relatives or folks that they're concerned with over in the general Orlando area, then you've been involved also in the property over there in Ocoee, you said.
Yes, and we have, Claremont, Ocoee, we have several residences.
Oh, wow.
We have a cluster in Tampa, so all over Florida, and they're just a spectacular company. Our leaders within our company have over 100 years combined experience in leadership.
Wow.
Just from a few people, and they are just phenomenal. I mean, it's just such a great group of people, and Mr. Benjamin is just spectacular. I got to meet him, and he's just great. Steve Benjamin, he's just one of my favorite people now.
No, it's great. And I was looking like on your map, the organization has places in Texas, Georgia, Louisiana. I mean, so you guys are like really all over.
We are around the Southeast. Like I said, we own and manage. We collaborate with investors and manage, and then we also manage other groups. So, and we're expanding. We've got an independent living going up in Jacksonville, which should be open within the year. We have one in Delray that should be open relatively soon, within the next 6 months, I believe. And then this one in Allura is going to look like April or May.
This is terrific. And so, again, if somebody wants to reach you directly,
absolutely,
what's the best number for them to get a hold of you?
My cell is 813-382-3584.
That's good. No, and I was going to say, it's really great to see how you have really stepped up and now looking at things actually on a corporate kind of level like that. It's really terrific, and it says a lot about the kind of work and care that you have for seniors as well. Like we talked about at the top of the show, you were really instrumental in helping us get through, I would say, successfully all the challenges of doing a car raffle in the middle of a pandemic, because it's not like we could go to car shows and show off the cars. So we had to come up with a lot of creative ways to do it. And even when we got right down to the drawing itself, we had hoped we would be able to open up the museum and allow folks in. But of course, safe is good. and we will wait and play safely another day. And in fact, we're still going to do that, by the way. People have asked us, said, well, is Mark Pylock, who is the owner of the American Muscle Car Museum, is he going to make the museum available for the folks that had the 2020 car tickets? And the answer is absolutely yes, as things open up. And that's been really what we've been talking about today, is the pathway towards recovery. And so I want to spend a few minutes that we have left talking a little bit about the Helping Seniors Cruise, because we were talking with last year, we picked a great time to launch the Helping Seniors Travel Club in retrospect. And for those of you that may not be familiar with this, what Joe Steckler, our president and founder, he had wanted to, from literally the get-go of Helping Seniors, create an environment where socialization among people can make friends, and so travel is what a great way to do it. If you've ever been on a cruise or any kind of organized vacation like that, you know that people make lifelong friendships in those kind of situations. And so Joe had said, well, what if we could get a group that's really from Brevard County, and we go and we have this cruise, or we do different travel kind of things, and it's socialization. And he said, I remember years ago there was a radio host in the area who would do a travel club out of this area, and he had 500-600 people go with him whenever he would do things. And so Joe said, I would love to see if we could build something up like that. And lo and behold, Chris Morse, who is Travel Center USA, he's been a travel agent since 1982, so he himself says it's when the dinosaurs were still roaming the earth. But he has quite a successful travel agency that's been West Coast based, but agents all throughout the United States. And he and his partner Betty, they live right here in Merritt Island, so they're local to Florida. And so he came over and he talked to Joe, and he said, I'd like to create a Helping Seniors Travel Club. And he said, this is what I'll do. I said, normally as a travel agency, we earn a certain amount from from the travel organizations for helping people with their travel. He said, I'd like to put that into the Helping Seniors organization. He said, I'm a senior, I'm special needs certified, I understand about helping seniors to travel. He said, so I want to make this be a plus for the Helping Seniors nonprofit. And he said, plus, if we do some things together, he said, I'm going to go to the different cruise lines and the different organizations and say, you guys got to support the seniors here in Brevard. So in doing so, he discovered that MSC Cruises, which is a popular cruise line, maybe not quite as well known in the United States as some of the others, but very, very popular in Europe. They're Italian, and they have the most spectacular ships you've ever seen. Well, he discovers that the MSC Divina is going to be sailing from Port Canaveral, our home port, year-round. So he said, Kerry, what if we could put together a cruise that would be for folks in Brevard County, that would be a fundraiser for Helping Seniors, that would sail right here out of Port Canaveral, so nobody has to get on an airplane to go fly to the cruise. Nobody has to take a long bus ride to Miami or something like that. They can just literally get on the ship here in Port Canaveral, have a beautiful 7-day round trip sailing. You don't even have to have a passport, okay? Because it's what they call a circle trip. So if you have a certified copy of your birth certificate and a driver's license, you are good to go. Because, even some of the people said, well, I didn't get to travel last year, so I didn't renew my passport. Well, that's not a problem. And then to top it off, because of his experience in the cruise industry, he sat down with MSC and negotiated a deal that I would say would be hard to find anyplace else, period. But he said, if people will book and make their fully safe, fully refundable deposit by February 15th, you can buy literally the lowest price cabin on the ship, and you get an upgrade. Now, normally, if you've ever looked at any deals online, they'll say, buy an inside, we'll upgrade you to an outside. In this particular case, he negotiated for the Helping Seniors Travel Club. You buy an inside, and you get upgraded to a balcony, so long as you are deposited before the 15th of February. So the time is moving quickly on all that, and you do have to give a call. But Charisse, I know when we talk about cruising, that's a tremendous value.
I love cruises. It's one of my favorite ways to travel. I mean, you think about it, you it's 24/7, so you can stick on your own schedule. You don't have to pack, unpack. Like once you're there, you're there.
You're just there.
I love cruises, so I'm really excited about this opportunity for our helping seniors at Brevard.
This is going to be a tremendous opportunity because it's as we were talking about too about COVID. You know, Chris has made the observation that just like flying became extremely safe right after everything that we all suffered through with 9/11, they were going to make sure everything was 100% safe. Well, so be it with the cruise lines. They're going to make sure it's 100% safe because, number one, they understand all these precautions the same way you folks do with assisted living, memory care, and those kind of things. So they're going to keep seniors and everyone safe. But also, he made the observation it's probably going to be the safest time ever to cruise just because everybody is going to be so attentive to everything and make sure all the precautions are in place. So let me give a phone number to reach Chris. That's 321-978-5211. 321-978-5211. But there is a time deadline to that upgrade offer. And one of the things that I want to say also about this cruise is that, you know, a lot of times people will hunt stuff down on the internet, and Chris and I were laughing about this. They'll call him and say, well, I saw I could take a cruise for $149. And he'll go, I don't think you can. He said, let's step through it together.
Yeah.
And so screen one says, you know, you can have the cheapest someplace down near the boiler room kind of cabin for $149. But then you have to add the government taxes and fees.
Yes.
That-
And I love, cruising, once you do really look at what's all included, it's such an economical way to travel.
Well, no, that's what I was going to say. So the way Chris has worked this out is he's put everything into one upfront price so that there aren't surprises. In fact, when you book, not only are you going to get your cabin, he includes the government taxes and fees, he includes your travel insurance, he even includes the gratuities. So once you get on that ship, everything is paid for unless unless you would choose to buy, unless you would choose to either buy a shore excursion or alcohol on board or one of the specialty restaurants. Everything is included, and you can just go with that. So again, you want to give him a call today. Talk to him about that inside to balcony upgrade. The phone number 321-978-5211. And so, Charisse, you said you've been doing cruising. Are you ready to get back to sea?
I am. I'm actually finally taking my first vacation at the end of February. Going to go down to Key West just to have a little reset button. But I'm all about cruising in May. So I actually have my cell phone right now. I was looking at the ship, and it's beautiful.
Oh, it's a lovely ship. Hey, John Harper, as we've been talking all the way along here, it's time for us to start at least thinking about getting things back to normal as we all get our vaccinations and everything like that. And I think this cruise is going to be a great way to, I'm just projecting ahead, but I really believe it's going to be a great moment to kind of kick things back to normal.
Those are incredible, unbelievable prices for the staterooms. I can't believe it. I've never heard of prices like that.
He said $790 is what you pay, and that is going to put you. That's going to put you into a double occupancy, but put you into a balcony stateroom, 7 nights, everything 100% paid. So you're not even going to have, to pay your gratuities on board. Your travel insurance is in there. I think he's even negotiated some stuff with some Wi-Fi or even some things like that. You'll have to call him and so I don't misstate that. But that's really the thing. So again, his phone number, 321-978-5211.
Very, very amazing. That'll be a great way to definitely kick off the cruising industry again and get going. As the two of you were just mentioning, and you and I, Kerry, have mentioned before, there's no better way to go than to cruise. And you can't beat it.
Now, I have a really important question.
Yes.
What's the minimum age?
There is no minimum age. In fact, we got a call yesterday from one of our relatives who lives up in Georgia and said, they're very experienced cruisers, and they said, we are so looking forward to get back to sea. I said, do we have to live in Brevard County to go? I said, no. In fact, that would be the ideal thing is you call your friends and family, get them on board, because the more the merrier, the way I see it.
I've got some calls to make.
Let's do it.
So let's get back to sea.
Let's do it. All right. Well, I think that's about our time for today's Helping Seniors radio show. So hopefully we may even have a special guest star, Joe Steckler, calling in next week. See you then.